So my name is Emily Wheeler. I am Head of Philanthropy and Partnerships at MQ Mental Health Research. And as I say today, here to talk about some of the work MQ is doing around workplace mental health. So although unfortunately he couldn't join us today in person, I am delighted that we'll also later hear from Geoff MacDonald, a global advocate, campaigner and consultant who is passionate about addressing the stigma of mental illness in workplaces. Geoff will tell us a bit about his own experience with mental illness and why he does what he does now. Before I begin, I should also let you know that I am not a psychologist, I am not a medical professional, and I am not here to give any personal advice about treatment or anyone's individual circumstances. I'm just here to tell you a little bit about the work that MQ does in this area and how you can get involved. So just to start off with a little bit about MQ itself. So we are the UK's leading mental health research charity, and through funding research, we aim to achieve three things. So firstly, to improve our understanding of how and why mental illness first occurs, which will help us to speed up diagnosis. Secondly, to improve our treatment of mental illnesses, because we believe that everyone should have rapid access to a mental health treatment that works for them. And thirdly, to work towards preventing mental illness before it even begins, looking at the factors that might put people at risk and developing interventions to stop mental illness developing in the first place. So really what we believe is that without research, it is just guesswork. So 1 in 4 of us experience a mental illness each year. The reality is that many treatments and interventions are often ineffective, and there's a real kind of trial and error period to find that solution for each person. But then how does that start applying itself to the workplace? Well, on average, we've managed to work out that about 17.9 million working days are lost each year to work-related stress, depression, or anxiety. But incredibly, more comprehensive research on the relationship between mental health and the workplace is still very much in its infancy. However, more and more we're able to see that the business case for a good business is also good business. The cost of not addressing mental health challenges is significant, unavoidable, and is rising. And even conservatively, poor mental health in the workplace is costing UK businesses between 42 to 45 billion pounds a year. And this is actually research that was done by Deloitte in January 2020. So that's obviously even pre-pandemic, and more work needs to be done to understand, well, what has the pandemic done and changed in those numbers, probably making them a lot worse. But what makes up those numbers? And this perhaps might be surprising to some of you. Actually, it's not that bit at the end here that it's mental health related absences, i.e. those days lost when people are not actually at work. The biggest contribution to that overall 42 to 45 billion pounds is what we call presenteeism, which is the lack of productivity when it works. So you're turning up, but you're not able to be your most productive, to be your best self. And that is actually the largest contributor to the overall cost. The next is then staff turnover. So obviously the costs associated with employees leaving and being replaced due to poor mental health. And of course, then at the end of that is the absences. But both of those, the staff turnover and the absences, obviously require people reporting that is the reason they left. So again, these numbers are likely very conservative. The thing that we can do about it is that there is actually a really high return on investment when we then start to do something about this in the workplace. And recent estimates that have looked at the fact that this actually means for every pound that we invest, on average, the return is about £5. And that will vary by the stage of intervention that is offered. For example, is it at the beginning to try and stop this from happening, or is it a firefighting at the end? Obviously, the one at the beginning has a greater ROI. The type of intervention offered, so is it in that firefighting, it's one-to-one support from a psychiatrist, or is it on a mass scale at the beginning, that culture change for the whole organization? Again, that being the one that's going to have the highest ROI. And obviously the size of the recipient group. The more people you can touch with that, for example, intervention means the higher ROI that you're going to get. But how do we actually build those mentally healthy workplaces? How do we do that culture change? And this is a wonderful way of putting it from one of our very close friends, Professor Miranda Wolpert at the Wellcome Trust. As she says, well, mental health science is the key to answering this question. It's not enough for employers to be investing in well-intentioned initiatives. They need to also invest in the science to understand what actually works. And as we've already spoken about, unfortunately, we do not have enough of that right now. So our vision is that there is a clear and urgent need for businesses and scientists to work in partnership to progress understanding of what works and what doesn't in order to support and grow mentally healthy workplaces. So our vision is that by bringing together this academic science of the community with the corporate sector, by 2030, no organisation needs to be without an evidence-based mental health framework operating throughout its workplace. But that'll be it from me for now, because now I will hand over to Geoff to tell you a little bit more about the why behind why we're doing this.
Hello, everybody. My name is Geoff MacDonald, and I spent 25 years working for Unilever, culminating in the global head of HR for all of our marketing, communications, and sustainability efforts around the Unilever world. Middle of 2014, I left Unilever to go out into the world and live a life fueled by a very, very deep sense of purpose. I think it was Mark Twain who once said, "The two most important days in our life, what are they? The day you were born and the day you find out why you were born." And I've become very clear on that why. And that is to try and create workplaces like yours, where every single person in a workplace all over the world feels that they genuinely have the choice to put their hand up and to ask for some help if they are struggling with a common form of mental ill health. And I don't think that that's a very audacious purpose. And let me tell you why. Because in every workplace, everywhere in the world, in every family group, in every friendship group, if you had a common physical illness, you turn to a peer, your line manager, your partner, your husband, your wife, and you'd say, "I'm not feeling well." Yet in the 21st century, as I speak to you right now, there are billions and billions of people all over the world suffering in silence. In silence. They feel ashamed to put their hand up and ask for some help if they're struggling with a common form of mental ill health, depression, anxiety, bipolar. Those in workplaces fear that it'll be at the end of their career if they were to put their hand up and ask for some help. How can that be in the 21st century? In a century when we're all mental, we're all physical, we're all emotional, and some of you would say we're all spiritual. Now, you might say to me, "Geoff, why are you so passionate about trying to create that kind of world?" And it's simple. I've got a bit of a story, and I'm going to share some of that story with you right now. Back in 2008, I'll never forget the date. It was the night before my eldest daughter, Jennifer, was going to turn 13. And I got woken up at midnight on the 25th of January, 2008, with a massive, massive panic attack. Now, I'd never experienced a panic attack in all my life. Never. I'd never spoken to anybody about a panic attack. I don't think it was part of my vocabulary. The ends of my fingers are tingling. The ends of my toes are tingling. The bed sheets are wet with sweat. My heart is beating profusely. I'm struggling to regulate my breathing. And because I'm so naive to this, I think I'm about to have a heart attack. And I bumped my wife, Debbie, and I said, "Deb, you know what? I'm about to have a heart attack." And she said, "Why?" And I tried to explain what I was feeling. And she said, "Well, why don't you get up, walk around the room and take some deep breaths," which I did. And slowly, the levels of anxiety began to subside. Got back into bed, but I couldn't go back to sleep. And I couldn't go back to sleep for 3 reasons. The first, the adrenaline was pumping through my body. Secondly, I was petrified that if I fell back to sleep, it might happen again. And I'm sure there are people watching this who've experienced a panic attack. You wouldn't wish it on your worst enemy. And the third reason I couldn't go back to sleep is because I developed a capability to catastrophize over the most insignificant issues in my life. I remember getting up at about 3 a.m, going into the bathroom, interrogating a small sore that I had on the inside of my mouth, getting back into bed and catastrophizing about the fact that I now had the beginnings of throat and mouth cancer. The next morning, who comes running into our bedroom? Jennifer. It's her 13th birthday. She's so excited. Her little sister Anna comes running in after. We have a tradition at home where we open presents at the end of the bed. And all I can say to Jen, to Anna, and to Debbie is, please, just leave me alone. There's no ways I can engage in anything that is enthusiastic, joyful, where there's noise, where there's excitement. And all I want to do is take the duvet, pull it over my head, and for the life of me, I can't get myself out of bed. Debbie takes the girls downstairs. They open presents. They go to school. She gets back at about 10 o'clock. Where am I? Still in bed. Now, I'm not the sort of guy who's in bed at 10 o'clock most mornings. I'm a typical South African. I love the outdoors. I love my sport. I'll go for a run of an early morning. I'll go for a bike ride. I'll go for a swim. And here I am on my daughter's 13th birthday, struggling to get myself out of bed. Debbie said, "What's wrong?" I said, "I don't know. I just feel paralyzed by the anxiety that I feel." She said, "Geoff, that's not you. You need to go and see somebody." I said, "Who?" She said, "Well, why don't you just go and see the doctor?" I said, "Why? I've got no aches. I've got no pains. I'm not feeling nauseous. I'm not feeling flu-y. There's no reason for me to go to a doctor." To cut a long story short, at midday on my daughter's 13th birthday, I'm in a doctor's rooms and I get diagnosed with anxiety-fueled depression. You know, as I left that doctor's rooms, I made a decision that saved my life. And the decision I made as I walked out that doctor's room is that I refused to be burdened by the stigma that is associated with the illness. Now, I was lucky in some ways. And let me tell you why I was lucky to be able to make that decision. There was some stuff that was in my favor. First of all, I had a diagnosis. I had a diagnosis. I felt liberated by what the doctor had told me what was wrong with me. Secondly, I'm the sort of guy, I just wear my heart on my sleeve. So what you see is what you get. I'm not very good at putting a mask on. Look me in the eye and you'll see there's something wrong. Thirdly, I was in a very senior job in Unilever at the time. I was doing a role looking after all of our home care division from an HR point of view around the Unilever world. I had 20 years of credibility that I built. I wasn't a young graduate or a junior manager chasing a career in Unilever. And probably the most important part of why I was so lucky to be able to make that decision is I had a line manager at the time who had a compassionate relationship to mental ill health. I was so lucky. He had a compassionate relationship, not an intolerant relationship, not a relationship where he saw somebody like me as some snowflake who was trying to skive the system. And so I had to take 3 months off work. I was so anxious. There is no ways I had any cognitive abilities because of the anxiety that I felt and the dark, dark days I felt. And during those 3 months, I had dark, dark moments, moments when I didn't think life was worth living. I was a burden to everybody. The world would be better off without me. But you know, the only thing that kept me alive in my darkest, darkest moments, the only thing that kept me alive in those dark moments, and I could only feel this because I'd been able to talk to my family, to my close friends, to some of my colleagues at work and tell them what was wrong with me. And you know what I got back from them that kept me alive in my darkest, darkest moments? The most powerful emotion in the world. And you know what it's called? Jennifer Rush, The Power of Love. Do you know, in my darkest moments, just knowing that I was loved by my 10-year-old, by my line manager, by my friends, kept me going. Together with one other emotion. And that is, I used to meet with a colleague who 2 years prior to my illness had been so ill, he'd been admitted to the Priory here in the UK. I was never that ill that I had to be admitted to hospital. And I used to meet with Martin, and you know what? I saw he was better. Do you know what he gave me? He gave me hope. He gave me that little bit of light at the end of the tunnel that I could get through this. I remember being so naive about depression. I remember the doctor saying, "Do you want some medication?" And I said, "Yes, of course I want some medication," because I thought it was like an antibiotic. You know, 48 hours, 72 hours, I'll feel better. Well, guess what? 6 weeks, 7 weeks, I'm still not feeling better. We have to change the cocktail of medication. But you know, just having that little bit of light at the end of the tunnel, just knowing that recovery is possible, looking at my friend. And so a combination of feeling loved and a sense of hope were probably the most powerful ingredients in my recovery. And yes, I took medication. And yes, I did some cognitive behavioral therapy. And yes, I slowly got back onto my bicycle and did a bit of exercise. And, you know, those things kind of worked for me. They don't work for everybody. We're all so different. But you know what I honestly believe? Is that the billions and billions of people who are suffering in silence as I talk to you right now, for them just to feel a sense of love and a sense of hope, I think are powerful, powerful drivers of recovery. And so, yes, I do recover. I go back into Unilever. 2010, I have a bit of a relapse, nothing as bad as 2008. And then in October of 2012, 4 years after my crucible moment in life, I lose a very good friend to suicide. And you know, here was a guy who used to bring so much light, energy, and passion to the world. Carl Jung once said, the brighter the light, the darker the shadow. The brighter the light, the darker the shadow. And that was him. That was him. And you know, I got home that night after hearing of his suicide, and I lay in bed. And you know, I'm not a psychiatrist. I'm not a therapist. I'm not an expert in mental health. All I am is somebody with some lived experience. But I lay there and I came to two simple conclusions. The first one is I thought to myself, what is the difference between him and me? Here I am in 2012, flourishing in many ways, learning every single day how to maintain my recovery as somebody who is susceptible to anxiety-fueled depression. And he's gone. What's the difference? And I thought, you know what? I've been able to talk. I've been able to ask for some help. I've been able to experience a sense of love and a sense of hope. He couldn't. He was an alpha male, Afrikaner, South African. There is no ways he could have the conversation. And so I lay there and I thought, you know what? Stigma. Stigma has just killed my friend. Had he had a physical illness, what would he have done? Spoken to his wife. Gone to see a doctor. But because he was struggling mentally and emotionally, he didn't think he could do that. And instead, he died by suicide. And I lay there and I thought, that is not fair. That is an injustice in the world. And so that night, back in 2012, I Googled Aleister Campbell because I knew Aleister was doing some work here in the UK in leading the Time to Change initiative. He was a patron. He was an ambassador for Time to Change. I found his email on his website and I wrote to him that night. And I asked if he would just meet with me. Within 10 minutes, I had a response from Aleister. A week later, we met up in Belsize Park. And ever since that day, November of 2012, he began to open some doors, introduce me to some people, which allowed me to take tiny, tiny footsteps on a journey filled with a deep, deep sense of purpose. And that is to create workplaces, family groups, friendship groups all over the world, where people in those settings feel that they genuinely, genuinely have the choice to put their hand up and to ask for some help if they are struggling with a common form of mental ill health. I co-led a piece of work in Unilever for a year and a half around breaking stigma, 2013, middle of 2014, and at the end or middle of 2014, I left Unilever to go out into the world and share those learnings with organizations and workplaces all over the world. And you know, I'm not saying to you today that had my friend been able to have a conversation, he would definitely be alive today. I'm not saying that for 1 minute. But you know what I am saying is, had he been able to have just one conversation, I want you to think of a grain of sand, a grain of sugar. There is a tiny chance he might still be alive. And you know, to give the billions of people who are suffering in silence right now, we talk about COVID being a pandemic. Mental ill health is a silent pandemic on a scale that we can't even realize all over the world. And to give those billions of people who are suffering in silence right now, to give them that tiny chance, that is worth fighting for every single day of my life. And you know, as I've journeyed this path over the last 8 years, I've often been in situations and given talks and spoken to individuals and teams and C-suite members and boards. And I often get asked questions around, what is the difference between depression and anxiety? Why are some people more susceptible to depression and anxiety than other people? Is stress a good thing or isn't it a good thing? How do we know what is distress? What are the symptoms? And sometimes I can't answer those questions. I can't answer those questions. And you know why I can't answer those questions? Because there is so little research that has been done around mental health. Do you know that the research around mental health is almost 50 years behind the research around physical ailments, cancer, diabetes? How can that be? How can that be? When all of us are mental, all of us are emotional, all of us are physical. And we all have mental, emotional, and physical struggles throughout our life. And so it gives me wonderful pleasure. It gives me wonderful pleasure, to support this charity called MQ. Why? Because MQ is funding the research that we so desperately, desperately need here in the UK. We so desperately need to understand and to better understand mental ill health conditions. And you know why? Because the more we understand, the more we can empathize, the more we can be compassionate, and the more we can then address the stigma of mental ill health throughout the world. As I talk to you right now, every 40 seconds, somebody dies by suicide. Every 40 seconds. How can that be? How can that be? And so to support a charity like MQ that is funding research that over time will help to save lives, to give people a better quality of life. What a wonderful cause and a wonderful charity to be part of. Thank you.
So I'll quickly take you through what we are doing exactly about this that Geoff has so beautifully outlined about this injustice and this mental health pandemic that is sitting behind everything else that we're doing. So at MQ, we knew we needed to bring this research to bear in the workplace mental health sector. And so began that search for really academically rigorous but business-minded partners and came across Peopleful and their research partners, the Workwell Research Institute at Northwest University in South Africa, who really fit that description. So Peopleful takes a data-led approach to understanding the greatest risks in the workplaces, their root causes, and the cost of inaction, as we've spoken about earlier. And Workwell is a multidisciplinary research unit at Northwest University in South Africa. They are experts in employee wellness and application of psychological and economic modelling. And the academic team behind the diagnostic tools here at the heart of Peopleful. So in terms of what our programme looks like, so firstly, there is the part one, working really in depth with your organisation. So we run the diagnostic tool with between 750 to 1,000 employees. And really quickly, you get this rapid bespoke insight into how your workplace is impacting the well-being of your people. We'll then be running facilitated workshops to understand all of that and look into the depths of each of those things. And then we'll run the whole thing again 9 months later to really build a longitudinal analysis to ascertain the efficacy of those different interventions. Each individual gets their own feedback reports to really understand from their own taking part what it is that might be their own risks and where they might need to take action. It gives you that summary of those things of what might be those potential stresses, the blind spots and areas for reflection. And really excitingly for those organizations, it can also signpost to the relevant resources that organization is already invested in and wants to make sure that its people have access to. The second part of that research program is looking at the wider business market. And it's bringing together all of that different data, anonymized research from those different corporates that we're working with to really have a better picture of what does the workplace mental health research in kind of sector look like? What does business look like right now? Particularly as we're coming out of pre-pandemic times, during it, and as we kind of emerge from it, and really building that evidence base we spoke about earlier that is severely lacking. And it also helps us really understand what is going on and how we build that evidence base to support workplace mental health right now. In terms of giving you a little bit more tangibility of what that looks like in terms of a time frame, really quickly we're able to deliver results. So that kind of we can come in right at the beginning, and within 6 to 8 weeks of running that first kind of survey is have that kind of organizational analysis and feedback within, as I say, those 6 to 8 weeks. Within 6 months, we'll have the first report of that broader research program. And then, as I say, we'll come back again 9 months later to be able to look and compare and understand what has changed or not in that time period, and therefore how effective those different interventions are. And then the final piece we'll have between that kind of 14 to 16 month point at the end of working with each organization, that research report of the whole program to understand what is it on a kind of bigger, longitudinal and global scale in terms of the workplace mental health and the state of it at the moment. So what does that mean for companies getting involved? Well, obviously, we need some internal champions to help commission and design the program. We really want to do it in a collaborative and cooperative program and way of doing it. We obviously need those 750 to 1,000 participants to take part twice over that kind of 9-month period. And obviously, engagement with the leadership team to make sure that we are being able to share those learnings, to feedback results, and therefore make those changes. It's a £25,000 program. And that means that if you have 1,000 participants, actually that's only £25 per employee to get that really rapid bespoke insight along that analysis for change. Those costs come together to fund both MQ's resourcing as a charity, the project administration, and a postdoctoral fellow at the Workwell Research Institute to undertake all of this work. And it's been amazing working with people who have been really generous to say that any follow-on work they get from this, they will make a 15% donation of any of that to MQ. So how can you get involved? There are a number of different ways. Firstly, of course, if you're interested in what we've spoken about today, you can become a workplace mental health research partner. So please speak to your employers and think about if you are the right people and who are the right people to discuss this with. And we'd be delighted to come in, whether virtual or in person, to have those conversations. We are also obviously a charity, as Geoff has so wonderfully mentioned, and we do rely on donations to fund our work. So if you have been inspired by anything you've heard today or in our other webinars, please consider making a donation of a few pounds a month, and you can also sign up and find out more on our website. But also have a look at taking part in research through our Participate platform. So Participate is a website run by MQ where anyone can volunteer to take part in research studies. Many of these studies are online, but some are in person, and the researchers often need volunteers both with and without symptoms of mental illness. So there really is something for everyone there. And lastly, if the company you work for runs a charity partnership scheme, then why not nominate MQ? And if there happens to be anyone on here from Deutsche Bank today, please make sure you vote for MQ this week. It is ending very shortly. And we'll pop the link in the chat. And for anyone watching afterwards, you can have a look at mqmentalhealth.org, vote for MQ. So there are many initiatives for mental health out there, lots of awareness raising, campaigns and services being offered. But without the research to back it all up, it is just guesswork. If any of you have any questions at all, please reach out to a member of MQ team and we would be very happy to help. And if you want to know more specifically about our workplace mental health program, you can contact any of our colleagues here, there's Marie, Kate and Georgie, to find out more and to, as I say, to have those conversations in-house to find out more about workplace mental health and whether your organisation might want to partner with us. That is everything today. I think we've finished literally just on time in terms of a canter through that. As I say, we'd love to give you more information. So please come and join us, reach out to us, and hopefully we can speak to you all again very soon.